Hi friends, thanks for joining today. My name is Dr. Monica Q. I'm a facial plastic surgeon and I'm in private practice in Beverly Hills and Newport Beach, California. Just a little bit about my training. I did my medical school in Pomona. I did ENT residency for 5 years at Detroit Medical Center, which is Michigan State University, and then I did a facial plastic surgery fellowship at the University of Toronto. Ever since then, I've been in private practice here in beautiful sunny California. And this year, I was just voted one of LA's top docs from Los Angeles Magazine. So I'm really excited to be teaching with you guys today. I'm really passionate about teaching. I'm with Michigan State University as a clinical professor, and I always teach residents, I host workshops, and I've been teaching with Empire Medical Training for the last year or so. So been teaching this particular training several times, and it's one of my favorite things to teach, botulinum toxin training. And I really love it because I consider it almost like a gateway drug. It's going to get the patients in to see you, and that's when you can really do a good job and sell them on your other procedures that you offer. Let's talk about what botulinum toxin is. So there's different names of it. There's Ono-botulinum toxin A, that's Botox. Inco-botulinum toxin A, which is the Xeomin. Prabotulinum toxin A, which is Jeuveau, and then Abo-botulinum toxin A, that is your Dysport. And it's all derived from Clostridium botulinum. There's 8 serotypes. The one that we use and the most stable is type A, and those are the ones that are available on the market. So it works by blocking the release of acetylcholine at the neuromuscular junction. The peak effect is usually about 5 to 7 days. I tell my patients they'll start noticing the effects anywhere from 3 to 14. I give a bigger range. And it does cause mild demyelination and some muscle denervation, which is what you want. That's the goal, because over time you want the muscles to get weaker and weaker and you need less product. The toxin can spread and diffuse at very large doses. When I'm talking larger doses, we're saying like 3,000 units, huge amounts. Very rarely never will you use more than 100, 150 for migraine. 155 is the normal migraine dose. So you're never anywhere near 3,000 units. Usually for an average female face, I'm using about 40 units. And then in male faces, we use about 50 units. Here's just a little pictorial on how that works. It blocks acetylcholine at the neuromuscular junction. It does that by binding to the nerve terminals, and that prevents the SNAP proteins and the cleavage. And so what that causes is eventual paralysis, the flaccid paralysis, and over time demyelination and weakening of that muscle. Here's a brief history of Ono-botulinum, which is the Botox. So it was first identified in 1895, 1920. The type A was first isolated, and then it was shown at 1953 to block the release of acetylcholine. The therapeutic potential was investigated by Dr. Alan Scott. So he was an ophthalmologist who was investigating this for blepharospasm. And so we credit him to discovering this potential use for botulinum toxin. And then it was finally approved by the FDA in 1978. And then for human testing, and then it received approval for strabismus and blepharospasm in 1989. And the name was changed to Ono-botulinum toxin A in 1991. And then let's talk about the stuff that's actually pertinent to us, the therapeutic indications when it was approved. So 2000, so not that long ago, 20 years ago, it was for cervical dystonia. Then finally 2002 for glabellar lines. That was the first indication for the number 11s. In 2012, chronic migraines. 2013 for the lateral cantharides or the crow's feet, and then it became quicker and quicker in 2015 for overactive bladder, 2017 for the frontalis of forehead horizontal rhytids, and then 2019 most recently for lower limb spasticity. Inco-botulinum toxin A, which is the Xeomin, It is also the same thing, blocks acetylcholine release, same exact mechanism of action, and it's branded as something else, Bocotur in other countries. It is also used for therapeutic indications like cervical dystonia, muscle spasticity, blepharospasm, hemifacial spasm, and it has been approved by the FDA for cervical dystonia, and it was approved in 2011 for the glabellar complex, number 11s, and this is made in the USA. I believe it's one of the only ones that is made in the USA. It's also, they like to call it the most pure type of botulinum toxin. That's something else that we'll go into. Let's talk about Jeuveau. This is the newest one that's been on the market. It was just released in 2019. Really big launch party. You may have heard of it. It was a big launch party in Cancun, Mexico. And they are really, really trying to promote more of the millennials. That's who they're trying to appeal to. So it was developed by Evolus in Korea, and they market themselves as New Tox. And again, it was FDA approved in 2019. And right now it is mostly, it's 100% cosmetic. There are no therapeutic indications. They are going to keep their goal, when I talk to the reps, is that they're going to try to keep it just all cosmetic. Prabotulinum toxin, try to say that really quick. That is same thing. It blocks the acetylcholine release, same mechanism of action. It is not used for therapeutic indications in the US. It is only approved for aesthetic indications in the US. Again, it's a Korean company. Botulinum toxin A. So that is the Dysport. That's manufactured by Galderma. It's manufactured in the UK. It has both therapeutic and aesthetic indications: cervical dystonia, cerebral palsy, muscle spasticity, blepharospasm, hemifacial spasm. It was launched in the UK in 1991, and it's in 81 countries now, and it's FDA approved in 2009 for the glabella complex. It is prescribed mostly by neurologists, it says, because for upper and lower limb spasticity. We love to use it here in the US for all the therapeutic indications in terms of the cosmetic indications. So it's another one that's very often used. So to talk about the different units. So they're all serotype A. The different ways how they're isolated, they vary a little bit. You can see that the Jeuveau Prabotulinum toxin A and Ona botulinum toxin A, they're very similar and often almost interchangeable. I know that it says that they are unique to each preparation and they shouldn't be compared or converted, but for me there's really no other way to do it. So when I think of, say, Dysport in the different units in that sense, and I always try to kind of convert the units together to find the right therapeutic indication.